Could you please give us a summary on your experience with caregiving and like your relation to kidney disease?
I guess unfortunately, I've had more than my share. It started off with my wife probably about 15 years ago, went through ovarian cancer. So there was that whole debacle and, having to contend with and navigate the system to try to get through that, which we were able to, and it was successful. So that's a good thing. And then following that, we also had, I went through the issues with mom. When mom started going through some of the issues, then I would primarily myself, but my brother occasionally, at the early days, where I would go in with her on the medical appointments. Primarily started off as just a translator, but then it became not just because her English wasn't bad, but she also had hearing issues. So if she didn't understand, she would nod. And to the clinician, the nod sometimes meant yes. And it's like, I know for a fact that she didn't understand the question, but she's just responding, trying to sort of camouflage that she was having trouble hearing slash understanding the question. So that was the primary purpose of the caregiving, just to make sure that we didn't get derailed through misunderstandings. And then eventually it just led up to, as her disease progressed, then it became more and more of a traditional caregiving role. So that would be my experience with caregiving.
Thank you so much for sharing that, and I'm so sorry you had to go through that. Can you share what it was like growing up with your mom's frequent health concerns, and how did her PKD journey shape your family's day-to-day life?
So at first, so mom was she seemed to complain a lot about a lot of ailments. This is before we really even understood PKD, and there was high blood pressure, and there was anxiousness and anxiety, and so it was almost like it appeared as, ailment of the day. So I think we became initially just desensitized to, okay, this is just mom. And we didn't really understand what PKD was. We knew she had some kidney issue. And it wasn't really until I started going in to some of the appointments that I understood that this was. And then also when I realized that, I was maybe about 20 years to 25 years behind her in terms of, having the disease and my progression. So that's when I started to, understand that this is more than just a sore arm or some event that will go away. The doctors would say that it would eventually lead to kidney failure, but because it was so far in the future, we really didn't, not that we didn't know what that meant. It just seemed, okay, that's almost like saying at some point we're going to die, which we all do at some point. So again, it was almost like a minimization of what was going on, but it became more evident that there was a little more to this than just mom's, complaint about the issue.
And so, based on that, how did your mom's history of being labeled a hypochondriac affect the way her later symptoms were perceived by doctors, by family, and even by you?
So the doctors actually were, to give them credit, though they may have recognized it, they never once would have said, hey, like, come on, give it a rest. Where we would see more of an issue is, if she was having palpitations or anxiety, and we would, she wanted to go into the emergency room. And there is where we started to see, because the ER doctors may not have, they've got so many things going on through ER that they may not have the same patients and the same outlook. So, they're general medicine doctors, and they're saying, oh, here she is again. And you could see a little bit of that happening. Our concern for the frequent visits to the ER was that if mom wasn't really sick, she may actually become sick because sick people go to ER. So she could catch something while she's there. And that was a bigger issue because, the last thing you want to do is go in for one reason and come out with another. And then you have to really go in for because there's a true ailment. But, for the most part, we would give her the choice. And though we would try to discourage her from going into ER, if she said, no, I'm not feeling well, we would take her. But always with a level of apprehension, saying like, we know they're going to measure her blood pressure. It will be high because she had the white coat syndrome. As soon as she would be at the doctor's office or whatever, the blood pressure would be high. And in fairness to her, I didn't quite understand the cause and effect of the disease, PKD, on the blood pressure. So yes, she could have, driven her blood pressure up, but that was a derivative of PKD. Like, so it's one of those things that until I started to experience it myself, and it's probably selfish, that you shouldn't have to experience it to really understand it. But unfortunately, that's what we did.
So looking back, what moments stand out most to you from the time she started dialysis?
When I look back with a lens of going through it, I can actually now go back and see like when she first started dialysis, and she started down at Toronto General, and then eventually once she was in a regular cadence, we got her moved to Humber, and that's where we met Dr. Hertz and the entire nephrology team. But when she started her first, 2 to 3 weeks at Toronto General, there was you could see her face was just like, whiting over. And it's almost like, well, okay, it's just no big deal back then. It's just no big deal. Like, they're this, that will be your kidney. This machine is going to help you, live on. We don't have a choice. You have to do this because your kidney function doesn't work. It was more this fear on her face. And especially like, she would ask us to go with her. And we're saying like, okay, that's for the first few days, fine. But then it's like, well, why? And, having gone through where, you're the experience of the dialysis unit where you're doing dialysis in a hospital, it's a bit daunting because, you go into this, what I call this long line of patients all going through registration. It's very clinical, like it seems cold. And for somebody who doesn't really know the language well, doesn't have the education, you could see that fear in her face saying like, what are they going to do to me? Now I can understand why she wanted, whether it was myself or my brother there. And the other thing was, back then we couldn't really, we had the choice. Well, we didn't really have a choice. They were pushing the fistula, that my mom should have a fistula in preparation for dialysis. We agreed to that. When she started dialysis, the fistula did not work well. There was, I'm not, we won't get into the details behind it, but it was a disaster. And then so she ended up getting a port put in for administrating of her dialysis. So now, having gone through the dialysis myself, and I used the port because I was actually doing home hemodialysis, which they were trying to push me on the fistula as well. Now I see the advantage. Like, I understand that there's an infection risk with a fistula, sorry, with a port, but there are also risks with a fistula. And so I didn't quite get that at the time, but until I started doing dialysis and I realized had I had a fistula, I could see where at home and even in unit, there are some significant challenges and unpredictabilities. So again, those are the two things that would really stand out after the fact, and predominantly because, I unfortunately walked down the same path.
Her English wasn't her first language, right?
Right.
And as well as she had hearing issues. So how do you think the unit was very accessible for her?
It was. It's just what we had to do was educate the clinicians. So, and what I mean by that was when they ask a question, if she just gives a nod, and first of all, we told her, like, they have to be facing mom so that she has a better chance of reading the lips.
Mm-hmm.
If they're standing behind her or to her side, the chance of her of hearing / comprehending were zero. So we had to make sure that they had this on her chart, and they were pretty good with that. They would try to face her. But then the second step was if you ask her a question and she just does one of these, like a smile or a nod, which is like an acknowledgement, re-ask the question a different way and see if you get the same response. Because quite a few times when myself or my brother were there, and she would, they would ask a question and she would answer, because we would specifically try to let mom answer the questions. And we knew what the answer was, but we said, let her do it. But when she answered and we knew the question was answered incorrectly, I would have to intervene and say, speak to my mom in Italian and say, okay, this is what they asked you. Is this your response? You go, no, 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 no. I said, okay, well, then you give him the right response. And if you don't understand the question, don't answer. Because she'd say, well, it's not what I heard. I said, well, okay. So that became a challenge. But once the nurses knew about it, and that became one of the challenges, because when you go into dialysis in the unit, though you may be in the same area, based on shift rotation, you may not have always the same nurse. Now, she was doing dialysis there for a better part of 10 years. Eventually, you will cycle through most of the nurses. But having it in her chart, it at least gave them a better chance, assuming that they read the chart, if they were new to that patient. So for the most part, it worked out. There were some hiccups along the way, but all of the doctors were very well versed with mom's limitations, the hearing limitations and comprehension, and they would work around it.
Yeah, I'm glad to hear that the experience was very accessible. What are some symptoms that your mom struggled with during dialysis, and how does she cope?
Um, Coping was a challenge. So some of the symptoms: the dehydration, cramping, fatigue, and tiredness. Um, so the diet, see, so mom coming from Italy, she had this, and based on her age, to her, a white coat was God. Like, you do not question anybody with a white coat. They're the doctor. So if they would say to her, we found your weight a bit too high, you have to, go easy on your liquids. To her, that meant drink no water. Like, there was no moderation. If they would say, as a dialysis patient, you should watch the amount of bananas you eat, her response to that is 0 bananas. So that would cause, problems from her on her diet side, because, her potassium swings were basically sort of off the chart at times. The dehydration, which then would cause cramping. At first, I thought it was strictly the water component. And it wasn't until I started doing my own dialysis at home, because basically you're doing you have to calculate what they call as your dry weight. So, you weigh yourself in the morning, you weigh yourself at night, you try to figure out what the difference is, and you know that you put on so much fluids, you run a calculation and you say, I got to pull out X kilos of fluid. For mom, it was the nurses that were doing that. She would weigh herself and then they would do the calculation. And then there was some level of, well, from the nurses, I think we'll leave a little bit extra or take a little bit more off, because so she had a variability that I did not have. So with me, I was very prescriptive, and I was the only one doing the calculations. It wasn't a different, nurse that was doing it. And I was running into problems with the cramping during dialysis, and there was no variability. And sometimes what we found out was it's just a machine. Though you program it to say take out 1.5 kilos of fluid, it would take out more, or sometimes it would take out less. So I always thought that was a miss on whether mom drank not enough water, or was it the nurses. But there's a factor that I wasn't taking into consideration, and that was the machine itself. The other thing that I noticed was she kept talking about being tired, and her hemoglobin was low, because your kidneys have trouble building up red blood cells. And then on top of that, it would cause bruising, ease of bruising and bleeding. So as an example, if she had any hemorrhoids, the blood would not stop easily, because during dialysis, you're also getting heparin, which is a blood thinner, to not allow the blood to clot in the pipe, in the tubes, while you're doing your dialysis. I didn't realize that at the time. So obviously, if you've got heparin in your system and you start to do a bleed, even a bleeding nose, well, it's not going to clot easily, because your blood is thin by design. And it takes, a little bit of time after dialysis that the heparin is out of your system. So these are all things there were struggles for her, and we didn't really understand them. How she coped was she would just complain about them. And sometimes, I would say to her, Mom, like, because they would say you can only drink a liter of water. So in her mind, that was, I'll drink one 500 ml bottle. And it's like, Mom, you can't be living off of 500 mLs. you have to be drinking more. And he goes, no, but then when I go in, they're going to find my weight too high. Then they take out more water and he cramps. So she was trying to do a little bit of self-medicating through the fluids, which would then trip her up because then if they take out the normal amount of fluids and she didn't drink enough water, now we get back to cramping. So it was a very a hit and miss, and it was that I could see that was really frustrating for her.
And during your own kidney disease journey, like when you went through it later, did you think her extremes were justified?
Oh, in a heartbeat. I mean, because I was doing it at home, you're your own clinician. So at 3 in the morning, if the machine's alarming and I find, this, and I'm finding myself lightheadedness, and, I've got to basically wake up, do what I've got to do to get the alarm to stop, bring some saline back into my blood because I took out too much water or too much fluids from during the treatment. And then once I would have it, that I was back into a calm state, that's when I would reflect back and say, this is what mom was talking about. And it's one of those things where, there's definitely a level of guilt on it because you don't really understand it until you go through it. And you don't understand how finicky it is. Like it's almost like a multivariable formula, and adjusting one piece affects another, and then it affects another. So it's not a simple solution. I look at it from the perspective of, I've got university education, I understand the language, and I find it challenging. So now here you have somebody who doesn't have the education level, doesn't have the language, and they went through the same things. So I could see why it was really daunting for her.
If you could go back, what are some other realities you wish you knew about dialysis patients, like daily struggles?
I think a lot of these things that we just talked about, and I don't want to say that the doctors didn't mention these things, but it's one thing hearing it from a clinician, and it's another thing hearing it from a patient. It's almost like what I'm doing now. So I've offered up to both, UHN and Humber, that if, a family or a patient wants, like early in their dialysis cycle, if they want to talk to somebody who's gone through it, that I will. So if I would have back then had spoken to a family member, and I probably may not have even realized the importance of it, but it should be more, let's say, emphasized and strongly pushed to say, here, don't listen to us, talk to somebody who's going through it. Because then all of a sudden you start to hear the symptoms and you start to hear the complaints that resonate with what mom's saying. So it's like, well, I can't have two people or three or four all saying the same thing without having that. There's got to be something here that I'm not seeing. So that would be probably the one thing is, try to push and offer up the like a patient advocate, for lack of a better word, but not family member. So like I was the patient advocate for mom, but it would have been great to speak to somebody who was actually going through it, or a family member, to say, this is what, my husband went through, this is what my son went through. And then you can start to recognize a lot of these symptoms.
After your mom passed, you were also diagnosed with kidney failure. Or kidney dis yeah. So and you went through home hemodialysis.
Yeah.
So how did that shift your perspective on what your mom went through? And also, knowing like were you able to find support in a friend or someone else that had went through the same thing?
The perspective changed 180 degrees. There's no question about it, because all of a sudden now it's like you're actually living it. And then that's when you start to reflect back and say, wow, that's what mom must have been referring to. I was fortunate in that, because I was going through home hemo, there was a training program. In my case, it was at Trauma General. And it will be no different at Humber, where you're basically sitting through a program, and sitting beside me would have been somebody going through the same training, but at a different phase. So they're already on their journey. At Trauma General, I had someone who he had been on hemodialysis through a port for a better part of a couple of years. Something went wrong, they had to put a fistula, so he was getting retrained on how to apply the dialysis treatment to a fistula, using the catheters, the needles. He was beside me. On the other side was another gentleman that was probably 2 months into his training. So once we all get connected to their respective machines, you now have downtime where you're not actually focusing on the machine and you have a chance to speak. And I think this is where that was very helpful for me because I was able to validate and, especially the one gentleman who'd been at it for 2 years already, the discussions of the diet, the fluids, dehydration, all those things they became relevant and they said, wow, so this is not just something that I'm going to go through or that mom went through. This is a common theme as a dialysis patient. And and the home hemo just enabled the ability for me to be able to speak to somebody close by. And like at Toronto General, the training program would have had a maximum of 15 people in the room, each one in your own station. But realistically, at any one time, there was maybe 10. So the ability to communicate with somebody was very high. Whereas when you go in unit, you are one of 100 and some odd on the unit floor between the east and the west wing. And you may be able to speak to somebody right next to you, but now you're getting into language barriers, cultural barriers. Like, do they really want to speak? They're having a bad day. Whereas when you're in the dialysis training, the comprehension of the English language is a must because otherwise you can't get trained. So that sort of at least puts you in a equilibrium that at least I know I can speak to somebody there because they've got to have a bit, like mom would never have been able to go through home hemo. Like her level of English and just the comprehension of following diagnostic flows was not there.
What were some of the hardest adjustments for you personally when you began dialysis?
So the feeling of being tethered to a machine where, even though I understood that was those are my kidneys, you like your whole schedule is based on when you're doing dialysis. So if you're going out at night, you got to be back by a certain time. Now, keep in mind, being on home hemo, I did have more flexibility than somebody that was doing it in unit because the dialysis machine was in my room. So I would try to start dialysis by 11 o'clock at night. But if we were out and I started at midnight, I would just run it an hour later in the morning. So I did have more flexibility, but you have to time everything around your dialysis. So if you're going to go visit friends, you say, okay, well, I can't drink as much and I can't eat this, and I got to be back by a certain time. So it's almost like the Cinderella, you got to be home by midnight, or the coach turns into a pumpkin. So that was difficult. The dietary balances were crazy because you can't eat this and you shouldn't eat that, and you got to eat minimal of this. You can't drink the fluids, and then like the fatigue itself became an issue, especially as my hemoglobin kept dropping, and especially after my bilateral nephrectomy, when they took out both my kidneys, there was some challenges, which then that created a whole nother dynamic. And then finally, just the biggest adjustment was the self-administration of dialysis. And don't get me wrong, I would not change it, and I would strongly advocate for somebody who can do it to do it at home. But that whole being tied to this machine, you're asleep, the alarms go off, and now you have to wake up, be ready to try to diagnose what the problem is without hurting yourself. We live in an area that, we were prone to power outages. Now you have a whole nother dimension. Like if the power goes out, you've only got like 30 minutes of backup battery to get the blood back in your system. Like it creates a bit of anxiety. So those things there became a bit of a roller coaster ride to navigate, but I was able to get through them.